Hey everybody, welcome to this episode. My name is Ashley Agan. I am a board certified ear, nose, and throat surgeon. And today I want to talk about pacifier use as it relates to recurrent ear infections. Now, using pacifiers beyond 6 months is an independent risk factor for recurrent ear infections in babies. And the mechanism for this is not exactly clear. There are hypotheses that it could be related to the negative pressure that's built up when they're sucking that helps promote pathogens from going up into the ear. So remember, the eustachian tube is a little tube that connects the back of the nose and throat to the middle part of the ear. And so that can be a conduit for bacteria going up in the wrong direction into the middle ear, where it can then turn into an ear infection. And then there's also a hypothesis that it can be from contamination of the pacifier itself, because frequently pacifiers are not routinely cleaned. And so if they're sucking on a pacifier and it's contaminated, then that can also potentially introduce bacteria that can turn into an ear infection. Regardless, though we may not know the exact mechanism, there have been numerous studies that confirm that pacifier use is an independent risk factor, meaning when you control for all the other things that we know can increase ear infections, like exposure to secondhand smoke or daycare where you're exposed to lots of other kids, even when you control for that, pacifier use still looks to be as if it is a modifiable risk factor. Now, if you are using a pacifier within the first 6 months, that's totally fine. I think as kids age and beyond that 6-month period, you want to wean them from the pacifier as quickly as possible. Some studies have shown that when you do this, you decrease the risk of recurrent ear infections by around 30%. And so again, if your child is experiencing recurrent ear infections and is still using a pacifier beyond the age of 6 months, this might be worth looking into as something you could possibly do to decrease that risk of recurrent ear infections. As you are weaning, some other things to consider would be only using the pacifier at night to help kids go to sleep and not using it during the day for soothing. Apparently, my mom tells me that I had a pacifier for a long time and eventually it was lost. And that was the way they weaned me from my pacifier, is that it was lost one day and then it was gone and then that was it. Whatever technique works for you and your family, but I think knowledge is power, and if this is something that could help you in your journey of trying to prevent recurrent ear infections in your child, then I think it's helpful to know. And if you have questions, please reach out, drop them in the comments below. Let me know if this is helpful for you.